Good evening and welcome to Just Seriously Voicing Thoughts with me, Kriss Venugopal. And today we have a very distinguished guest, the Executive Director of Vaidyaratnam Group, a group which was started way back in 1941. And this year marks 100 years of the celebrated title of Vaidyaratnam given to Dr. Krishnan Moose' grandfather by the British government in 1924. So Neelakandan Moose, who was the MD, and from him the executive director post comes to Dr. Krishnan Moose, and he's a member of the Ashtavaidyan Taikata Moose family, additional chief physician, Vaidyaratnam Nursing Home Private Limited, trustee, Vaidyaratnam Ayurvedic Foundation, board member of Vaidyaratnam Ayurvedic Educational Society, associate editor, Vaidyaratnam Journal of Ayurvedic Medicine. The honor and pleasure is always mine, son of E.T. Neelakandan Moose from the LA Datta Taikata Mana, Taikata Sheri. We have Dr. Krishnan Moose with us. Welcome to the show, sir.
Thank you, Chris.
The main idea of why I would initiate this talk is the misconceptions which had been there for so long. You run a Ayurvedic museum where people can get to understand how Ayurveda works. You are running a college which actually teaches Ayurveda. And the common talk with a lot of people, we find that Ayurvedic medicine, should we have it? Should it be consumed, or should it be only used superficially over the skin? There are a lot of misconceptions. Now, being a person who even runs a molecular level Ayurvedic research center, what would be the first thing that you would like to tell the people who do not understand the power of the age-old medicine system of India, Ayurveda?
Okay, so when we speak about Ayurveda in the present scenario, more of a wellness perspective comes to most of our minds. So there is a wellness perspective towards Ayurveda. That's accepted perspective. But there is another illness perspective where we can do wonders to make a difference in a person's life. So, see, whatever the treatment we do in Ayurveda, it ultimately ends in wellness, that we make a person happy in the life. But to reach that, we need to go through different phases. That may include medicine, that may include treatments, and sometimes it doesn't require anything. So I'll give you an example from a clinical perspective. So there was a case came to one of our hospitals with an issue of infertility. The only medicine which we gave was counseling. So, if you ask me as a doctor's perspective, it's all about understanding the patient and the disease. So then the outcome will be much better. And regarding the concept of the doubts regarding the medicines, whether it's safe or not, any medicine, whether it's Ayurveda or allopathy, if it's not judiciously used, it can cause damage in the body. So I can't say you that it will not have any negative effect in the body unless it's not judiciously used. So that would be my take on this question.
When we talk about certain medicines using heavy metal like arsenic, or certain like the use of Tangabhasma, we have had a lot of people talk about the negative side of it. Is it true, or is it just a misconception or a myth which has been propagated amongst people?
See, we use certain kind of metals and alloys in making some of the medicines, but we use in a very minimal quantity and in very minimal time period, and we don't overuse the medicines. So, if we use in a stipulated time period of a certain disorder, it will not cause any kind of damage. But when you speak about these damages, the other end is about the production of these medicines. We have to follow certain parameters, quality parameters, while making any kind of medicines. So if we don't follow those parameters, it will definitely have some damage. So I can't say that it will not just the medicine that is leading to damage, but if the quality parameters is not met, yes, it will make a damage to the body. And if it's not used properly, overdosages of medicine or self medication or using it for longer duration for more than 1 month and 2 months, it can sometimes lead to damage. But we have to evaluate the condition by proper renal function test and liver function test to make sure the patient is on the safer side.
Mhm. The advent of new medical technologies like the MRI or the scan, there has been a kind of a different take on by a lot of people saying that, yeah, why should an Ayurvedic doctor suggest a scan? Or why should actually resort to some kind of a diagnostic method which is not advised in, say, Ashtanga Hridaya or any specific test, whereas we have the specific Nadi Chikitsa, or they understand the pulse of a person. And from there, the deduction, the Vada Pitta Kapha, is calculated and it is taken forward. So, the advent of new techniques or technology and the amalgamation, how would you look at it?
So I would take those in a very positive note because it's all about the patient and it's not about the science. That's what we think, right? So
Hmm.
for you, if you're visiting a doctor, you don't mind whether he's a Ayurvedic physician or an allopathic physician. It's all about you want a cure to your problem, a solution to your problem. So
Hmm.
to find out the problem at the present era, we have different technologies, and that will
Hmm.
reduce the time to diagnose the patient. So if
Hmm.
we use those methods and diagnose, that will be a better solution for the patient. Definitely, there are certain parameters where we assess the patient, like Nadi or the visual appearance and different parameters in
Darshana.
Ayurveda. But we have
Hmm.
sometimes we have to mix both of them. It's not just like we have to only go with MRI or just to go with the other parameters. See, the concept of Ayurveda is not about treating the illness. It's all about treating the patient with an illness. So we have to
Hmm.
understand the patient, understand the disease, then we have to treat. So, in my perspective, the modern diagnostic criteria are very useful to reduce the risk of any treatment. See, if I have a patient with a swelling and I just randomly take it as a normal swelling and start treating, and what if it becomes a malignancy? So
Hmm.
better we identify what is the real disease, and if it's malignancy, if it's not which can be treated with an Ayurvedic medicine or treatment, then I should refer that patient to a higher to whichever medicine that can give a cure. So it is a right method of identifying the disease, and it is very useful in the present scenario.
Hmm. Now, when it comes to your research center, the advent of new ways to, uh, say, administer the medicine, are you looking at any advancement in Ayurveda when the research perspective, or is it on a ongoing process which has been over the years being done?
Ayurvedic research has, over a period of years, there has been a lot of changes in Ayurvedic research. So in
Hmm.
Ayurveda, when we say a drug or a medicine, it should be divided into two parts. One is a molecule, one is a drug delivery system. For example, most of you will be familiar with the ghee-based medications, kritas, or kashayas, or any kind of formulations. So there will be a molecule and a drug delivery system. So when we see these in two different perspectives, we can have research in both. We can adopt the new drug delivery system, for example, lipid drug delivery system, and infuse the molecules traditionally used in Ayurveda, so that the better usage of the drug will be there. And other research, when you see the clinical research, for example, we have a device called Agni Karma, a protocol
Hmm.
called Agni Karma, used for the acute pain management, where we use the five metals in a different form to give heat on a particular pinpoint area, for example, tennis elbow or plantar fasciitis. So
Hmm.
recently, we did a study on converting that technology from a five metal combination into an AI supported device, where this device will detect the area, age, and everything. Then the heat will be decided by the device. So
Hmm.
we can take up a lot of research in Ayurveda. So one in a validation perspective, one is in a research perspective that can improve the efficacy of the medicine. One is in a way to improve the safety of the medicine, other one can be improve the quality of the treatments. So these are the main areas where research would go ahead, in my perspective, in Ayurveda.
Hmm. Now, we are talking about the modern day scenario, the kind of, say, we had COVID attack, and a lot of people did claim that Ayurveda had a cure. And when we take homeopathy, they actually came up with arsenic album and the kind of different kinds of treatments, but it was never accepted as a kind of a treatment. Instead, everyone had to resort to kind of a vaccine, and now there has been a lot of contraindications regarding the vaccine usage. So, does Ayurveda have a cure or any kind of methods to prevent such kind of diseases, or is there any other way where we can look at the modern medicine being left behind or Ayurveda being left behind in such cases?
So during COVID times, the one of the most common drug that was used was Chyawanprash, which was very common in our daily practice. So
Hmm.
when you look into the phytochemical action or pharmacological action of a Chyawanprash, it actually balances your immune levels. It does not increase it or it does not even decrease your immunity levels. So
Hmm.
there was a misconception that everyone should boost your immunity with Ayurvedic medicines. So when see if someone increase the immunity levels, it can lead to a hyperimmune reaction.
Hmm.
So there is no point in increasing the immunity levels. You have to have a balanced immunity. So the medicines that was given as a preventive perspective during the COVID times was on a immunomodulatory level that was working. For example,
Hmm.
Chyawanprash. But when you get affected with COVID, obviously we need to improve the heart rates, need to improve the functionality of the lungs. So these kind of parameters were taken into account according to each case. So accordingly, we had to symptomatically manage case to case. So if in the
Hmm.
preventive perspective, we had to go for immunomodulation, then according to each case, we had to give particular medicines.
So, do you really believe that the kind of vaccines did it work, or do you feel that it had other indications on a like medical perspective?
I would say vaccine did a great work in my perspective, because
Hmm.
whatever the research that's been discussed in the scientific forum or among the public regarding the negative effect of vaccination, we need to relook into the real numbers and percentage. See, there is a risk benefit ratio in every science.
Hmm.
So we need to understand the risk because and consider the benefit out of this. As science is every action has got equal and opposite reaction. We need to look into the risk benefit ratio and then take a call whether it's really a benefit to take it or not.
Hmm. Now, let me move from this side of, say, COVID and the treatment side to the museum side, where the Ayurvedic Museum, which your family does give to the world to understand Ayurveda in a better perspective. Now, what is the takeaway for a person who is visiting the Ayurvedic Museum?
Okay. So the ideology behind the museum was to educate the people that Ayurveda is not about just a massage or just a disease. Ayurveda is all about a lifestyle. It's not about
Hmm.
just curing or treating a patient. So when you look into the first few chapters of Ashtanga Hridaya, or few maybe the first book itself, Sutrasthana, it never tells about a patient or a medicine, nothing like that. Just tells
Hmm.
you how you have to live a healthy life according to your seasonal changes, your daily routine, and etc. So we try to make sure with, that any age group who visits the museum understand the history of Ayurveda and the present scenario of Ayurveda and how it will be in the future. So we are trying to educate the people who's not from an Ayurvedic background and try to tell them it's a science and science of living. It's not just a cure.
Hmm. But I mean, is it in a way that um, people are moving towards understanding it better, or they look at it as just as a museum?
No, they do understand, because when you come into the museum or Ayurvedic museum we have here, we don't have some historical evidence that's been collected from certain parts of India. We don't have much of them right now. So what we have tried here is to make some we did some research and display the Ayurveda from a historical part, then a mid-19th century part, then to presence. So when a student or school student come to our museum, we have to tell them in a very in the way they can understand it. But when a adult or a senior person comes to our museum, we have to tell them the way they will accept it. So it's not about the thing that's being displayed there, but the way we convince them regarding the history, the present research works, and what is the idea of Ayurveda. It's not that is not just the treatment, but a healthy lifestyle. But we can't tell this to a student of maybe a kid of just 10 years or 12 years. We just try to convince them what is a healthy lifestyle, how to live a healthy lifestyle, and so on. So it's not about the things what's being displayed, but we the way we convince them that what is Ayurveda, or regardless of Ayurveda, what is a healthy lifestyle, how to take it, why we say that. That's what we try to portray in that museum.
Right. Now, moving to the aesthetic side of it, there is a common belief that kaya kalpa chikitsa, like you can reduce age, anti-aging factor. How far is it possible?
See, when I'm saying that there is a possibility, I need to have clinical research records and maybe case studies to that's been published. So far, we don't have any such case studies that's been published. But when you ask me as a doctor, theoretically or whatever we have done so far, see, whenever we give a medicine which is of a Rasayana property, it will help the cells to have a healthy ecosystem. So rasayanas are those drugs which can work on your microcells to improve the quality of the cells, and by that method it improves your the mind and body in a better way. So it's not about reducing the age, but to improve the quality of the cells. That's what I would say in a more technical way.
Hmm. Now, the time period which we look at a treatment when it's, say, allopathy or homeopathy, Ayurveda, the time period which Ayurveda takes, the time period which homeo takes, the time period which allopathy takes, is it the fast paced life and people want instant relief? Now, how far Ayurveda believes in instant relief or a complete cure over a period of time?
See, we may have, as a doctor, we may have to treat both acute cases and chronic cases. So sometimes it's about the disease, and then we have to connect with the duration of the cure. For suppose if I have a patient with tennis elbow or a knee joint pain, we can give a cure according to the case. I'm not telling all the cases. Maybe some small muscle injury because of a sports injury, something like that. We can give a quick cure with minimal modalities. But if it's related to something, a ligament tear of meniscal tear with such surgical case, we have some, we need to give some time duration for that. So it's not about the science and the duration. I think it's more of the illness and the duration.
So, the thought which has gone into a person's mind. Is it just a misconception that Ayurveda takes a long time?
Uh, uh, you see, for example, I'll give you. If we treat a patient of sciatica, there are cases we can treat with just internal medicine, and we can cure within 2 weeks or 10 days. But according to age, according to the severity of compression, according to symptoms, we have to analyze. Sometimes it will take long time as well. So we have to analyze in a more technical way or a disease perspective than just a science perspective.
So it actually gives a different picture what people have understood, or probably my understanding about Ayurveda itself. Now, if a person wants to really try out the effectiveness, uh, is there any particular way that he can understand it? For this particular disease, Ayurveda is better. Do we have any kind of data which actually supports that for such diseases, Ayurveda is better? For such diseases, you might have to resort to some other modality.
Yes, for example, the last disease which I told, like a meniscal tear. See, if it's there's a different categorization of a meniscal tear, which is a ligament in your knee joint. If it's a
Hmm.
case of a bucket handle tear, which is very extreme case of a ligament injury,
Hmm.
the patient may need to go, need to take a surgery for that, need to undergo a surgery for that, because meniscal is a ligament or a fiber material which does not have much of a blood supply. So if
Hmm.
I'm giving a medicine to a patient, it is acting on it's going to your gut and digested, going to blood, then it acts on that particular area. So when the blood supply is not there much, then the point of giving the medicine and getting a cure in a maybe short period or long period, it's not easy. So in such
Hmm.
cases, definitely we would suggest the patient to go for a surgery.
Hmm.
Or for
No, the point.
example, if I have
No,
a
the.
patient stroke management cases, patient will have a multiple infection during the course of treatment in our hospital also, because the patient will
Hmm.
not have much movement. At that time,
Right.
we have an allopathic doctor in our facility where we request the doctor to take care of that particular infection.
In the recent times, I would say within the past a few years, or say even say 10 years back, there had been a heavy discussion of whether Ayurveda needs surgery. But the fact remains that we have the other than the normal ways what we hear about Ayurveda, we do have the Susruta and Charaka and the plastic surgery cases and all that as a historical evidence. So, what is your take on surgery and Ayurveda?
See, it is a fact that surgery was widely practiced in among Ayurvedic doctors in way long back time period, not in recent times.
Hmm.
But later, maybe in between, there was less research in surgical perspective. That was a lacuna in Ayurveda regarding the surgery. But when you compare to the surgical treatments in Kerala and other
Hmm.
states, when you look into the Karnataka and Maharashtra, you can see a number of surgical cases that have been operated by Ayurvedic physician, following all the legal formalities. And here in Kerala also, as per the government of India, an Ayurvedic physician is allowed to do 64 surgeries.
Hmm.
So at present, these are being conducted in different parts of India, and Kerala also maybe doing around 10 to 12 kind of surgeries, but not all
Right.
of them.
Mm-hmm. And now, when we actually look at the age-old text and the kind of medicines or the availability of certain plants or certain, say, ingredients which goes to make Ayurvedic medicine, do you really feel the fast-paced modern life has taken away a lot of plants, made them extinct, and we are missing out on the special abilities which we had in the past years?
Yes, definitely. I think maybe before COVID and after COVID, when we compare, one of the other issue what we faced was the people who used to identify the plants correctly. They
Mm-hmm.
We lost many of them, senior people. So there was
Mm-hmm.
a gap in identifying the correct raw materials or correct herbs which has to be used for producing any medicines. And other part due to maybe reduction in the forest and maybe the climatic changes, we have lost many of the herbs which was widely available in our maybe in local area also. For example, tulasi, we have around more than 5 varieties of tulasi, but we can only find maybe one or two varieties right now.
Mm-hmm.
So yes, there is a definite maybe reduction in the kind of herbs that was available in the past. Maybe in 5 to 10 years back, we had a wide variety, but nowadays we are facing a lot of issue in finding the correct herbs. And regarding the herbs, thing is that there are different sub-classification, different varieties of herbs. The scientific
Mm-hmm.
name may be the same, but we have different varieties of that. And correctly identifying the herbs is another big task.
So, do you really think that there should be more research and more R&D in getting those plants or reviving those plants, or is there a possibility, or have we completely lost it?
There is a definite possibility. There is a department under Government of India working towards this. It's called NMPB that works for the to promote the cultivation of the herbs. So we
Mm-hmm.
have been connected with them, and we are trying to produce some herbs for our production purpose, I would say. But thing is that when we speak about cultivation, we need to make them cultivate them in a climatic situation where it has to be produced. We cannot produce some herbs that's been widely available in Himachal or northern part of India in South India because of the change in climate. So there's a natural habitat. But when you see that, it's not feasible to go to North India and start producing these herbs.
Mm-hmm.
There's a practical difficulty in that. So there are opportunity as well as challenges, but I think with a great effort we can overcome that, at least in a very minimal way.
Right. Now, at this point, I would like to let the audience know that you can directly interact with Dr. E.T. Krishnan Moose, the director of Vaidyaratnam Aushadashala. And I would take this opportunity to thank Thomas Mani, my sir, who actually taught me biology and was my principal too, Kanimuri Srinivasan. We have Bhagyalakshmi, Semi Kabir, Sharat Chandran, Dr. Santosh, Saumya, Sonia Sebastian, Mustafa Amin, Fanaiki Andrea, Srijesh, Renuka Verma, Sita Gopal, Ani, and Tripti Agarwal, thank you very much, and a few people whom I have missed out also. Now, coming back to you, Dr. Krishnan, before we open the stage to everyone else so that they can interact, one more thing which keeps getting back to me, another field of mental health. Now, how far mental health and Ayurveda, or specifically, I would take two of the other fields also, ophthalmology, because the age-old use of, say, Ilanir Kuramba and other kind of medicines of Ayurveda in the eye, people are saying you should not use it. And for mental health, they say Ayurveda, what can Ayurveda do about it? So, would like to get the clarification on both those fields specifically from you, doctor.
Okay, so regarding the mental health, we are getting a lot of patients with different kind of issues. It might be a simple anxiety or stress issues or different kind of other clinical issues as well.
Mm-hmm.
So maybe when you compare the issues of kind of patients coming into our clinic before COVID and after COVID, during COVID times, I would say there was less cases of anxiety or less cases of this mental issues coming to us. Maybe they were living together with a great harmony,
Mm-hmm.
but though after that we can see a lot of difference in that. It might be because of the change in the lifestyle. They're continuously working from home, less interaction with the public or society. That has made a great negative effect in most of the people who we meet in our clinical practice. So
Mm-hmm.
when we speak about mental health, we need to first identify as a doctor what is the root cause of this issue. It might be an anxiety, it might be a stress, it might be a depression. So during COVID times, one of the major issue what we faced was for adolescent girls, there
Mm-hmm.
was less interaction with their friends, peer group, or teachers, where they can share their issues, personal issues, or family issues, also the menstrual issues. They can't see a doctor without parents' help. That time it was very closed. They were not able to meet a doctor as well for this kind of
Mm-hmm.
issues. They had a lot of anxiety and depression because of that, and that also maybe impacted in their next phase, maybe after COVID, and that has impacted their menstrual cycle, their studies. We have certain cases like that. Sometimes I feel like maybe the family and the support they get from the society, that is one of the major issues that leading to these kind of issues. But in a
Mm-hmm.
medical perspective, it's not about just medicine in treating these mental issues. You need to find out, sometimes it might be a family issue, then we just need
Mm-hmm.
to give them family counseling and let's see, wait for some time to resolve that issue, and then
Mm-hmm.
it will not reappear also. But some kind of cases like schizophrenia or some depression, there we may have to go for some internal medicines or the treatments, but not in all the cases.
So
So,
it is available.
sorry,
It is available in Ayurveda.
it is available in Ayurveda. So
Mm-hmm.
we normally start with counseling the patient and the family to understand and to give them the idea what is the issue and how to we have to give them the whole idea of the disease or what he or she is facing that time, educate both the patient and the family.
Mm-hmm.
Then the treatment part or next part will be easier for us. What happens is sometimes it's not sometimes family will not accept the fact that the person is going through a depression or an anxiety. They will say
Mm-hmm.
that they are just neglecting my words, they're not obeying what we are saying. The parents used to say that a lot, but actually it
Mm-hmm.
might be a anxiety issue, it might be a depression, or it might be something else.
Mm-hmm.
And when we try to resolve that, a lot of issues will be handled without medicine. So that is the beauty
Right.
of a mental health issues by managing the mental health issues.
Mm-hmm.
So, and when you go for the ophthalmologic issues, so when we treat ophthalmologic issues, we need to first find out it can be a simple dryness or myopia or glaucoma or different kind of illness. So we just need to find out what is the illness first. So it can be a whether it's a problem with eyesight, it can be a neurological issue, it can be because of a local like a problem with the eye, so it can be age related. So we just try to find out what is the cause there, then
Mm-hmm.
accordingly we treat that. So yes, there is a definite and proven treatment cases, case studies and case series in terms of ophthalmological cases.
Now, specifically the kind of usage of, I mean, I have heard my grandfather talk about using Ilanir Kuramba for the wellness of the eye. So, such kind of Ayurvedic administration of medicines, specifically for the eye, does it reduce the risk of glaucoma, or does it reduce a risk of having cataract or any such? Is there a preventive method through Ayurveda to preserve the condition or the health of the eye?
Yes, this is one of the most common method we use as a preventive perspective regarding eyes. So normally it
Mm-hmm.
starts with washing the eyes with the water that's being boiled with tripla powder,
Mm-hmm.
and after that only we use this kind of Elanir Koram or any kind of medicine that applied in the eyes. So it's about cleaning the
Mm-hmm.
eyes and giving more support for the regeneration or for the rejuvenation of the cells in the eyes. That is on a preventive perspective. But we don't suggest that on a daily basis, at least. For example,
Mm-hmm.
when a patient comes to the clinic with a solution, asking for a solution for maintaining a better eyesight, to maintain this eyesight, something like that, we don't advise on a daily basis. Normally, we advise
Mm-hmm.
on weekly once. You can use this for washing the eyes with tripla powder, the water, and then to apply the Elanir Koramb.
Oh, okay.
Yeah.
Right. We have Samya Santosh here and from PKD School, Polachi. So, Samya, the stage is all yours.
Hi, Krishnan.
Hi, how are you?
I'm good. So, I'll tell you a similarity. You're also Dr. Krishnan, and my brother is also Dr. Krishnan, even though he's popularly called as Kriss. So, the first thing which I want to tell you, and what I want to ask to you, Krishnan, is can you tell something about the rejuvenation therapies we do there? And the effect on it? Is it just a sort of, should we do it regularly, or how should actually that rejuvenation therapy be done?
See, when we speak about rejuvenation, I can give you an example that can be seen on a daily basis. So when you see a flower in each season, it goes through different phases, right? From budding stage to flowering
Mm-hmm.
stage. So that happens because of the climatic changes of that time period. And because of that climatic changes, there are certain chemical reaction in the flower in different phases, right? So likewise, when there is a change in season outside, there we have some chemical reaction and enzymatic and hormonal reaction inside the body. So when it goes beyond a certain kind of reaction, it leads to a disease. So when we speak about rejuvenation or preventive medicine, it starts with correcting the body in these phases first. For example, when it's a change of season from summer to winter, summer to likewise, we need to correct the equilibrium of the body with proper diet and exercise and proper methods of practicing some of the principles. So when we maintain that, you don't need to undergo any kind of major treatments. But when you don't practice certain ritucharya or dinacharya according to the season, this will lead to a disease. So that time you need a treatment based on the disease. But when you most commonly there is a concept of doing Karkataka Chikitsa in Kerala. That time there is a high chance of various reactions of enzymes and hormones in the body. So that is why in Ayurveda it advised to take some Panchakarma treatments during the change in seasons. So during that change, we can control the reactions of these enzymes and hormones, leading to a disease. That's how we define rejuvenation in a Ayurvedic perspective.
Great. Thank you very much, Soumya, for the question. And we have Dr. Santosh Rajgopal. Dr. Santosh?
Yeah, good evening, Krishnan.
Good evening, doctor.
Okay, so I'll just mention an anecdote and then I will go into my question. So I remember this interaction between your great grandfather, whom we used to call Vali Tirumani, and my father, who was an allopathic physician. For those people who don't know, so at that time, his great grandfather, he must have been like 80 plus, and my dad was explaining something in the eye because I remembered it because Chris was asking about eye. So at that age, your great grandmother wanted to know the exact anatomical detail of what my dad was discussing. I think he was thinking about retina or something. And he was exact detail about he wanted to know what are the eye. So I was just, I understood that at age he still want to learn more things. So I'm so happy that this generation is carrying on that pursuit of, pseudo-evidence and pursuit of one-sided science in another way. Because at that time, of course, the research was very far away from Ayurveda. Now it is not like that. So coming to my question, the question is a lot of conflict today that I see between the modern system of medicine and Ayurveda, especially in Kerala, because I sort of practice, maybe I can say both states, Tamil Nadu and Kerala. In Tamil Nadu, generally the approach is positive. Even allopathic physicians don't hesitate to recommend or even, accept Ayurvedic alternatives. But nowadays, in the last, maybe last decade or last 5 years, there's a lot of conflict between Ayurveda and modern medicine. There's a lot of, I would literally say, bad blood between the two. How do you propose as a young Ayurvedic physician to overcome this? Do you have
Thanks
any
for the
idea
question.
as an
So I
industry?
think we have a lot of discussion regarding these doubts from the public or from the other science, whether it's useful to do Ayurveda or whether it's scientific to do Ayurveda, and there's been a lot of confusion in the public as well as in the other sciences. But as a doctor and as a person who's working in Ayurvedic field, as a doctor, I would say that there has been good coordination among the both allopathic doctors and Ayurvedic doctors in a great way. Only I could find few pockets where this confusion is there, but I think there will be some confusion always when we do something. But I would say in my clinical practice, I would like to neglect those portions and focus more on a patient perspective. And when you look into global perspective, there has been a high demand for integrating multiple systems. For a patient, as I spoke in the for the answer for the first question, it's about the The patient should get a betterment. It's not about Ayurveda, it's not about allopathy, it's not about homeopathy, it's all patient. So whichever better for the patient, there should be a protocol where the patient will get maximum benefit. So I would say that it's high time to integrate sciences on a patient focused way or patient centric way for a better output for the society.
Thank you. I will leave it to other people to ask more questions. Thank you.
Thank you very much, Dr. Santosh. And yes, audience, if you want to interact and ask a question or share a feedback, yes, you can raise your virtual hand and I'll take you on stage and you can directly interact. In the meanwhile, let me come to a kind of a doubt which pops up at this point, where if a person wants to learn not as a complete medical practitioner, is there any, say, certification or a minimal study of Ayurveda possible? Being having an educational institution, you would be the best person to answer that.
In a structured way, there are no such courses apart from the bachelor's or the post graduation degree. But uh, when whatever I've seen in the social medias and other person when we interact, they learn from the books or from the few interactions or by being with some of the senior Vaidyas, they understood what is Ayurveda, and then they are trying to propagate the positives of Ayurveda. So to cut the story short, there is no such short courses where you can learn Ayurveda at the present scenario.
Is if it is just the Panchakarma Chikitsa or a kind of a basic study, is it possible?
No, there is.
No.
It's not
Okay.
practical. See the. I would give an example for that. There's a common practice to give head oil for a patient according to the disease. Frankly speaking, even after my post graduation, it took me around 1.5 to 2 years to scientifically, fully learn about this head oil application. It's not about the application, but it's about understanding oil and correctly using it on the patients.
Yeah, so there could be a possible difficulty which can ensue from such kind of misusage.
Misusage, yeah.
Right, yeah. We have Sharachandran VS. Yes, the stage is all yours.
Yeah, good evening, doctor. See,
Good evening.
I had one question to you as an Ayurvedic doctor and as an entrepreneur. What is your opinion about the last 2 years? See, there was a gradual reduction in the youngsters applying for Ayurveda colleges for admissions because there are lot of seats are vacant in so many Ayurveda colleges. That means the youngsters are not interested in going to Ayurveda. What is your opinion regarding this one?
Yeah, it is a fact that there has been some challenges in Ayurveda regarding the young generation coming to learn Ayurveda and to practice Ayurveda. So when we interact with the young group of people who have come to our college, so we feel that there is a type of insecure feeling in their mind whether they will get a job that when they compare with your friends from the childhood, whether they will get the enough pay for the job. There is a mind of insecurity feeling in the mind. But at the same time, I have seen young doctors practicing very well. So I think at this juncture, we need to work a little bit more to improve the confidence level among the Ayurvedic students coming to our college. And there is a challenge, and we need to find a solution for that. And only solution is to give confidence in treating a patient and to make sure they get a better lifestyle or while do practicing this science.
Okay, thank you. Is there any steps he is taking from this industry?
Yes, see, it's so when you industry perspective, or any job when you take for IT industry, you take when the IT industry is booming around the world, you make a lot of job opportunities, and when it's in a global level, the pay scale will be more, and likewise. So it's all about taking the Ayurveda into greater heights. in a global platform. So there will be more research funding, there will be more acceptance toward Ayurveda. So we can create more job opportunities for the young doctors and Panchakarma therapists and nurses. So at this juncture, we need to validate the science in a global platform and standardize it so that Ayurveda will have its boundaries expanded. So when we expand those boundaries, there are more job opportunities. They can work around the world. So we need to practice, and there has been some steps taken from the state government and central government to take up this scenario of their challenge in a better to find a better solution.
Okay, thank you, Doctor.
Thank you.
Thank you, Sharashandran. Doctor, ensuing the same topic of the learning factor, when you look at Ayurveda as a whole, yeah, specific bachelor's and master's. But when you look at the subgroups or what you can actually term it as a part of Ayurveda, but still being practiced separate. Say Marma Chikitsa, we have Nadi Chikitsa, and you have different ways of approaching Ayurveda. That being separate, bringing it in under one umbrella will improve a kind of the view of people towards Ayurveda.
Did you mean like teaching the maybe in a
Because
not in a
Marma Chikitsa, it completely goes into the calorie side of it, or maybe the lifestyle side of it. When you see the Nadi Chikitsa, they actually say that, yeah, that is separate and that's different. And though it actually becomes a part of Ayurveda itself, or probably the kind of view people have towards it, it really is different.
See, when we speak about Marma Chikitsa, the well-versed explanation of marmas is you can find in the Sushruta Samhita. So the
Yes.
Acharya Sushruta explained about all the marma with its anatomical positions, and it's also classified into different ways, like whether this marma impact can cause immediate damage or death likewise. But when you look into the chikitsa of marma, it is more explained in Tamil vermology than any other maybe books or sciences. So it's not even in the Kalari, it's been more explained. It's in Tamil vermology. So it's not easy to bring everything in one under one umbrella, because as a doctor, we cannot learn everything in 5.5 or 8 years. So we need to specialize in something. It's not easy to learn everything. You can learn the basics of everything, but it's not easy to practice everything at the same time. If imagine we should see, when I'm treating a patient, I should have a basic sense of marma, basic sense of modern anatomy, basic sense of pharmacology and everything, and also the basics of Ayurveda. But my way of treatment will be a little bit different from a marma specialist.
Right. The perspective changes. So it
Yes,
cannot be brought under one umbrella.
it is not easy. See, it's also something related to your the present curriculum in the college. See, the present curriculum is totally different from what my father used to learn in the college, or grandfather used to learn from the gurus. See, when we have those kind of, see, nowadays the undergrad student has to learn about the research methodology and statistics, but it was not there when I was doing my undergraduation. But when I was doing undergraduation, the Charaka Samhita was in the curriculum. But when father was learning, it was all about Ashtanga Hridaya. So when we, but the 5.5 years of course is not expanded, but we have different topics. So it's not easy to learn in 5.5 years or even in the 8 years of a curriculum.
Right. So we have to look at it as completely separate fields of study.
Yes, see, I would say that we should learn the basics of everything. But when you want to practice Marma Chikitsa, you should spend more time on understanding the Marma and how to treat, and to get trained under a senior doctor who's experienced in practicing the Marma Chikitsa.
Now, we often see on newspapers topics about specific surgeries, and we talk about a lot of aspects of medicine, modern day medicine, and there is a in-depth say, news value for such surgeries. This particular doctor did this surgery and all that. But Ayurveda practitioners, probably they are not getting that exposure that even if a big thing has been done, is it really carried? Do you think there is a kind of an, uh, say, shirking off or maybe ostracized when you look at Ayurveda as such? Or maybe even in Tamil Nadu, we have Siddha medicine, we have Unani in the Andhra Pradesh side, we have the Yunan, the Greek methodology, and different kinds of medicine. Those are being sidelined or ostracized from the mainstream media, and it exists probably in YouTube when somebody says miracles happen.
See, I say that for some that. Also, when I speak about this topic on a commercial perspective, if I'm a program from the major clients, right? So this major clients will have a major market share, even any kind of science. So normally they will have a tendency to support those people who's giving them more ads.
Oh, right, right.
It's a more of a commercial perspective in there. So we interact with a lot of media persons. So you also say that they're getting enough support to they have to run the show sometimes. So I would say that it's in that perspective, and but when you see the recent editorials or any features in most of the papers in Kerala at least or India, there has been some tremendous changes regarding portraying Ayurveda as a scientific way, not as just a wellness perspective. And since there has been few issues regarding some ad policies in India, specifically regarding to Ayurveda, the Supreme Court also told the same thing that there should be strict regulations while advertising regarding Ayurveda. So you can nowadays we cannot advertise an Ayurvedic drug and tell in the ad that you can consume this and you will get the cure. It's totally prohibited.
So, do you think it is a healthy practice?
It is a healthy practice. See, if you have a diabetes and you start taking a diabetes medicine without looking into your blood sugar values, it can lead to damage, right? So,
Right.
so you should not consume any medicine, even Ayurveda or allopathy, without a proper consultation with the doctor.
So, it is not an over-counter drug. Ayurveda can not be an over-counter drug. Is that what it boils down to?
Yes.
Right. So we are looking at the number of people going into Ayurveda coming down, as such as Sharat Chandra sir said, and people even moving to veterinary science, for that matter, avoiding a particular field of health science, which has been existing for so long in India. So, what are the steps a common man can look at, or maybe to experience Ayurveda, or what are the things what a common man can do to take it to the next level, saying that, yeah, I trust in Ayurveda?
See, to begin with, as I told you, you need to have a healthy lifestyle. So Ayurveda gives you a clear picture how to continue a healthy lifestyle or how to maintain a healthy lifestyle. So without medicines, without doing panchakarma, you are getting a healthy lifestyle with the help of Ayurveda. So first thought should be that, not just into medicine. So with that way, you will get a confidence about Ayurveda that this can help me to have maintain a healthy lifestyle. So after that, when suppose you have a fever or suppose you have a headache, so there are different modalities where we can, with the help of Ayurveda, we can give you a betterment in headache or fever or in such diseases, not just in chronic illness. So once you believe in Ayurveda, then you should consult a doctor and try to get a recovery with the help of an Ayurvedic doctor. So the only that confidence will come. But at the same time, it is the duty of a Ayurvedic doctor or Ayurvedic industry perspective to prove to public that Ayurveda has got a solution in a very scientific way. For that, we need to validate the science with data. It should be published in peer-reviewed journals and likewise. So both should work hand in hand. It's not about just public. At the same time, as an Ayurvedic doctor, I have an responsibility to prove to public that it is safe and how if it's used judiciously, you will get a cure as well.
Hmm. So, when we are, say, experiencing Ayurveda as a Panchakarma treatment or looking at as a modality of treatment of diseases, there is a long way we have to go before we still take pride in our system of medicine, which is so very deep but still ostracized. Before coming to the last question, I would like the audience to know that, yeah, here is a chance for you to interact with Dr. Krishnan himself, who is the director at Vaidyaratnam Aushadashala, and you can make use of this opportunity. And let me come to the question of the future of Ayurveda, because so much of research is happening right away. The kind of a doubt a person has is the kind of the smell of or it's actually fragrance for me, but people call it, yeah, it smells in a different way. The use of kashaya or the oils, it is not aesthetic enough for people to say that, yeah, I'm using Ayurveda, or the kind of difficulty in using a modality, because if you're traveling, you don't have a quick system or a quick relief in Ayurveda. So what are the possible future additions or modifications what Ayurveda is going to have when you have such a research center? What is your outlook towards Ayurveda becoming more acceptable on an easier way?
That's a really interesting question. See, as you rightly mentioned, when I prescribe a medicine to a patient, he or she will say that it's not easy for me to consume with the smell, or it's not easy for me to take this when I'm traveling somewhere. So, when you compare to an era where physicians or the Vaidyas used to write the name of the herbs that has to be collected from the local market, and they just used to write how they have to prepare and give it to a patient. From that era, it changed into a time period where we have kashayams in a bottle to consume. Then
True.
now we have kashaya tablets
Right.
instead of kashayas. So there will be another phase where this whole drug delivery system. So these are drug delivery systems. This is the vehicle where we have to infuse this molecule to and give to a patient. So there are different research going on regarding the drug delivery systems in Ayurveda with the help of a modern pharmacology, where we can reduce these issues of smell and to carry the medicines. So definitely is going on, and we see a good future in the research of drug delivery system by which these issues can be sorted out. Yeah, so definitely I see a huge potential in that area. And apart from that, so it's not easy to use a body oil when you're traveling somewhere for the pain and etc. But nowadays we have liniments and different change in the systems with the same molecule explained in the text. So the basic concept of Ayurveda will not be changed, but with a proper validation technique, there are changes in the drug delivery systems and some of the molecules. See, there was a previous question regarding the availability of the herbs. So there is a great issue regarding the availability, and due to which we have to sometimes take a different set of medicines, a different set of herbs instead of what it's been explained. But we just compare the HPTLC of this drug and to make organoleptic evaluation, and we adopt this drug. So sometimes we also go for extraction techniques to get a better yield of this drug for particular disease.
Doctor, it was a really enlightening talk regarding the future of Ayurveda, the present state of Ayurveda, and the Ayurvedic education and the museum, and different modalities. We really have got an insight into what we need to think more about. Your parting notes about this session we had now.
Yeah, sorry, there was a glitch in that.
Doctor, your parting notes.
Thank you for this
About the
session.
session.
Actually, basically, this opportunity was really good to share about the Ayurveda. And see, when I, some simple takeaway that I would say from the session of anyone who like Ayurveda or who want to experience Ayurveda is Ayurveda is not a science that cure a patient. It's about living a healthy lifestyle. But there are methods by which we can prove how this is explained. For example, we are doing a research on gut microbiome, where we try to understand how the gut microbiome in different cases in a healthy individual and a particular diet and such modalities in a personalized way, not in a same diet for everyone. So the ethics of Ayurveda, the values of Ayurveda also tells about personalized medicine, not the same group of medicine for everyone. So it is a way ahead in Ayurveda where we have to validate the science with its basic value systems and principles, but with the help of the modern technology, which can be judiciously linked together, and not about just the biotechnology part, but with other science like allopathy or homeopathy. In a judiciously better way, we have human life. Like we have to make a change in a person's life with the help of integration, not just Ayurveda or not just allopathy, but as a patient-centric approach.
Right. So it was a real pleasure having you here and looking forward to hearing from you again very soon. And thank you very much for joining us. And to the audience too, I'd like to thank for their presence and their questions and the interaction. Thank you very much.
Thank you very much, Chris. I enjoyed this session.
Thank you very much. You're welcome. Just seriously voicing thoughts with me, Kriss Venugopal, every Thursday, 9:30 p.m. India time and 8 p.m. UAE time. Be there. I'll be there with another guest next week, same time. Good night.